talk to you a little bit about asthma this morning, and I know this is something that you guys definitely, see with your kids at your school. So I don't know if you guys remember these posters a long time ago that would be kind of inspiring, but all these posters that I have here are kind of the antithesis to those. So never underestimate the power of stupid people in large groups. I'm not sure what that has to do with this talk, but I think that's apropos. So here's our objectives. I'm going to kind of impress upon you guys the importance of the topic. I think we get comfortable with things that we see a lot, and I'm not sure that we should ever really be real comfortable with asthma. So we're going to kind of talk about the importance of the topic, and then a little bit about pathophysiology, what's actually taking place in the body that's causing this kid to have trouble breathing. And then, understand and recognize how it presents clinically. And then, why is it important to make a proper diagnosis? Because it could be, there's a lot of things that cause shortness of breath. And then, what do you do acutely? And what can you do about asthma without medication, which is certainly something that you guys could consider. And then look at common medications and figure out how to use them, and then also be aware of the fact that some of them, these athletes can test positive on drug screens. So what asthma is it's an increased sensitivity or responsiveness to the airway. So there's a lot of different triggers that can cause the airway to kind of constrict and slow down the flow of the air. But what was realized probably 20 years ago, the whole asthma idea kind of changed from this responsiveness, this hypersensitivity, to it's really more of an inflammatory process. So as the inside of the tube gets inflamed, it fills with kind of swollen mucus, kind of that kind of stuff, and that closes down the amount of movement of the air as much as the tube actually constricting. So it's a combination of the two things. The smooth muscle in the airway constricts, but also the size of the lumen, the size of the tunnel, decreases because of the inflammatory process going on inside of it. And we'll talk about why this idea of inflammation is kind of important in a little bit. So that's what asthma is, okay? So there's kind of two terms here, and kind of teasing these apart to kind of clear up some of the confusion is a little bit difficult. And as you read an article about any of this, you need to be kind of asking yourself, is this exercise-induced bronchospasm, or is this asthma that has been triggered by exercise? They're two kind of separate things. We'll talk about how that breaks down here in just a minute. But exercise-induced bronchospasm is not the disease. The disease is asthma, okay, with all that comes with that. The bronchospasm is acute, it's reversible, it's self-limited, it increases the airway resistance as physical activity is a trigger to do that. Okay, so you're not getting as much of that inflammatory process as you get when you have asthma. So there's a little bit of a difference there, and we'll kind of break that down into percentages here in just a minute. So I think this picture actually does kind of fit. It doesn't take any effort whatsoever to just sit there with a dumb look on your face. There are some instances that have been highly publicized where an athlete had asthma and everybody just kind of didn't really consider that as a real important comorbidity that this athlete has. And so it was kind of like, well, he's a little hot, he's just out of breath, and it's early in the season, they're out of shape, and next thing you know, this asthmatic is really gone down the tubes. So if you know an athlete has asthma, or anybody has shortness of breath, then you really do have to kind of be on the alert and take all the precautions. So what's all the fuss about exercise-induced asthma or exercise-induced bronchospasm or whatever you want to call it? It can be that you have an athlete that has one of these issues, and the disease itself may not be dangerous for that athlete, but it may actually cause them to pick a different sport or not be as active or whatever. So it can kind of change their lifestyle. So that's one of the reasons why this idea is an important idea. With exercise-induced bronchospasm and exercise-induced asthma, the limitation in how much airflow is going through there is reversible, even with asthma, the disease. But if you continue to kind of have these bouts of asthma, then every time you have one of those bouts, it causes some remodeling of the tissue in the tube, in the bronchiole, and that remodeling then can lead to some chronic kind of irreversible changes that then continue. So even though asthma by definition is something that is reversible, if you do it enough times, you create some changes that you can't reverse. There is, our society, there is so much asthma out there that mortality, death from asthma is actually on the rise in the U.S. So it is dangerous. And then if you really look at the cost, and this is actually an old number, this is probably 10 years ago. But if you look at how many people have to go to the emergency room or get treatment or hospitalized for asthma or whatever, it's a big deal. And then of course the number of deaths that you see each year that are attributable somehow to asthma. And certainly, with the coronavirus, if you have asthma, then it's more likely that's going to tip you over into something. So these numbers are certainly going to change with the coronavirus. So to kind of tease this out a little bit, about somewhere around 5% of our population is known to have asthma, and in that group that has asthma, exercise-induced bronchospasm, you can trigger that in about 50 to 80% of people who are known asthmatics. Okay, does that make sense? Okay. In the general population, if you have somebody that kind of has seasonal allergies or has some skin allergies, or is just kind of this what we call atopic or allergic, about 30% of them will have exercise-induced bronchospasm. Not necessarily asthma, but exercise will trigger some breathing issues, okay? If you don't have asthma or allergies, only about 3 to 4% of that population has exercise-induced bronchospasm. I'm one of those people. So I'm in this really, really small group. I don't have allergies. I don't, seasonal allergies don't bother me. I don't have a diagnosis of asthma. But if it's warm I'm not in the greatest of shape, and a few other factors, then I go do an activity, and that night I'm coughing, and I can feel it. I take a deep breath, and it kind of hurts, and it causes me to cough. So a very small group of people have exercise-induced bronchospasms and don't have anything else. So if you have somebody who has exercise-induced bronchospasm, you have to think it's real likely that they've got underlying asthma, or they're kind of this atopic kind of person. If you look at the Olympics, about 8% of the Olympians have asthma, and that's real similar to the general population in the U.S. So athletes are not all that different. And in 2012, in London, there was about 700 out of the 10,000 that were competing that had a confirmed diagnosis of asthma. So it's pretty common. Almost 1 out of 10 have asthma. So here's what's happening. You know, you breathe, the nose filters the air, the turbinates in the nose warm the air, and then it comes down into the larger tubes and then branches off into the smaller tubes called the bronchi. And all the way down, it's getting warmed by your body. It's being filtered by different cilia and so on and so forth, so that it gets down to the smallest division, which is called the alveoli. And those alveoli, where the air goes into those little pockets, is where the capillaries and will bring the oxygen into the blood at that very lowest area. And so you can see from these, you know, the size of all these different branches, if you start to kind of change the inside of the tube, it's going to be real difficult for all that air to get all the way down to these little grape clusters called alveoli and oxygen to actually get into the blood. So there's a lot of reasons why the inside of these tubes can get inflamed. Just breathing heavy with activity, that hyperventilation that comes automatically with activity, can irritate the inside of the tube. Just the amount of air that's kind of rushing and the number of times that you're breathing can aggravate it. Asthma's worse when the air is cold, so the cold air can actually both trigger the smooth muscle, but it also can trigger an inflammatory kind of phase. So if you're not able to heat the air well enough, then it will trigger some of this. Also, there needs to be humidity in the air. So if you're breathing in really dry, cold air, your body can't humidify it well enough once it gets down into these little tubes. And so that drier air is also an irritant. And then once you trigger, just like, you know, you guys probably know a little bit about an inflammatory process. You know, whether that's a tendinitis or a bursitis or inflammation on the inside of the breathing tube. It's all the same. It's all mediated by a bunch of different chemicals. And if you trigger it, then all those chemical mediators kind of get involved. And then there's also a component that if you go from kind of cold air to warm air back to the cold air, you can kind of get this rebound, rewarming that can trigger